Imagine fleeing your homeland, seeking safety and a fresh start, only to face a new battle, putting food on the table. This is the harsh reality for many refugees arriving in the United States, as a startling new study from the University of Utah Health reveals. While gaining entry to the U.S. is a monumental achievement, it doesn't guarantee an end to their struggles. The study, which you can explore further here, /plos.altmetric.com/details/179479998, sheds light on the alarming rates of food insecurity plaguing refugee communities, a problem often overlooked in the resettlement process. Food insecurity, defined as limited or uncertain access to nutritious food, affects refugees at a staggering rate of up to 85%, 6 times higher than the general U.S. population. This isn't just about hunger, it's about health. Refugees are forced to rely on processed, high-fat foods, leading to poor nutrition, while the stress of uncertain meals contributes to mental health issues like anxiety and depression. And this is the part most people miss. Even when refugees secure employment, they often fall into a gap where they earn too much to qualify for food assistance programs like SNAP, Supplemental Nutrition Assistance Program, but not enough to cover food costs alongside housing and utilities. Nasser Sharare, the study's lead author and a research assistant professor of population health sciences, emphasizes the urgency. We can at least ensure refugees know where to turn for help. They're navigating a new culture, language, and society. They need time. But in the meantime, let's make sure they have the information they need. Sharare's words highlight a critical, yet often overlooked solution: better communication and access to resources. The study, based on interviews with 36 refugees from countries like Syria, Afghanistan, and the Democratic Republic of Congo, found that 83% had experienced food insecurity in the past year. But here's where it gets controversial. Many refugees were unaware of vital resources like food pantries or programs such as New Roots, https://newrootslc.org, which helps refugees grow their own food in Salt Lake City. This lack of awareness raises questions about the effectiveness of current outreach efforts. Are we doing enough to bridge the information gap? The refugees themselves propose simple yet powerful solutions: translated materials explaining food banks, SNAP applications, and community gardening programs. These low-cost measures could empower refugees to access the support they need. Additionally, the study calls for increased funding for resettlement agencies and greater involvement from community organizations and policymakers. Sharare also points out the economic implications. Food insecurity costs the U.S. healthcare system approximately $53 billion annually. Addressing this issue isn't just a moral imperative, it's an economic one. By tackling food insecurity, we can improve public health and reduce societal costs, he notes. So here's a thought-provoking question for you. Should ensuring food security for refugees be a higher priority in U.S. resettlement policies? Do you think current efforts are sufficient, or is there a need for systemic change? Share your thoughts in the comments. Let's spark a conversation that could lead to meaningful action.